Good evening and welcome to LSSNCA's Town Hall. I'm so glad to have you guys here with me tonight. My name is Hernessa Faryad and I am one of the board members. I'm also head of outreach and interfaith at the All Dulles Area Muslim Society. And we are here tonight to give an update about what's been going on at LSSNCA and all the great work that everyone's been doing. But we want to let the community know what's going on because we feel that the interactive relationships we have with everyone in the DMV area is very important for the work that we're doing. And I can't think of better people to come on stage and do this work and to give you guys an update than Kristen Peck, our CEO, and of course, Dr. Sai, who's going to, he is the VP of Operations, and they're both going to dive deep into what's been going on and give you guys updates. And then we will have a Q&A at the end as well. So if you have any questions, please feel free to drop it in the chat box and we will get to them at the end of the program as well. So I will, with that being said, I'm going to introduce you to our CEO, who is Kristen Peck. She joined the Lutheran Social Services team in November of 2020 and as its Chief Executive Officer. Prior to joining LSSNCA, she served as the founding CEO of West Michigan Partnership for Children, a nonprofit piloting an innovative performance-based child welfare model, where she was the recipient of the 2020 Michigan Federation of Children and Families Advocate of the Year Award. Kristen also has served as the Associate Director of Children's Services at the U.S. Conference of Catholic Bishops, where she oversaw national family reunification and foster care programs for unaccompanied children, served as chair of the Vulnerable Minors Working Group of Refugee Council USA, testified to Congress on the protection needs for unaccompanied children, and represented USCCB as a subject matter expert on unaccompanied children at UNHCR's, excuse me, it's late at night, annual consultation meeting in Geneva. And with that being said, Kristen, thank you so much for coming here and being on this town hall for everyone. And let's get to it.
Thank you so much, Hernessa, for all you do for LSSNCA and for the community and for the lovely introduction. I really appreciate it. And thank you all for joining us tonight. We know it's 7 o'clock on a Wednesday and you have plenty of other things to do. And we're just so grateful you're here with us and that you've stood by our side throughout the years and particularly in the last few months and been a part of this historic welcome. For those of you who might be new to the LSSNCA table, welcome. We have been serving the DC metro area for more than 100 years. And LSSNCA is known for evolving to meet the changing needs of our community while staying true to our mission of fostering resilience and creating welcoming communities. And so our work to respond to this current crisis in Afghanistan is an example of us showing up where we're needed and stepping in and doing so with the support of all of you. So tonight, I'm going to share a little bit about the current status of our work to welcome Afghan allies. And then I'll turn it over to Mamadou, who will give us a look ahead. And then it'll come back to me. I'll share a little bit about our community engagement efforts. And then as Hernessa said, we'll go into the Q&A. So for the current status, according to the Department of Homeland Security and its Operation Allies Welcome Program, as of February 2nd, more than 68,000 Afghan evacuees have joined communities across the United States. And you were all a part of this historic welcome in the DC metro area. And we're so grateful to have received such an outpouring of support. We would have not been able to do this work alone. And with your support, we've served more than 4,000 Afghan refugees who arrived as special immigrant visa holders or through humanitarian parole status across our Virginia and our Maryland offices. In less than 3 months, just one of our Virginia offices resettled 600 people, which is a great contrast to our average of 500 people a year we served through the refugee program under the previous administration. Virginia has the highest resettlement rate of Afghan allies across the United States, behind Texas and California. And LSSNCA is leading the way. This gives you a picture of how many we've served in each of our offices in Fairfax, Dale City, and in Hyattsville. But we couldn't have done this without the help of more than 2,000 individual volunteers who clocked nearly 50,000 volunteer hours. You've shown up to update resumes, provide rides to the doctor's office, offer jobs, help fill out paperwork, enroll in public benefits, and welcome our new neighbors to the community. We're thankful for all of the congregations, community organizations, and groups who work side by side with us and our Afghan allies. We have grown so quickly to respond to this crisis that we've outgrown our spaces. And so we're moving. Our Hyattsville office is relocating to Greenbelt, Maryland, and our Dale City office is moving to Woodbridge, Virginia. And so we will drop those new addresses in the chat for you. We were recently honored with Lutheran Services in America's Micah Award, which recognizes a member organization leading the way in addressing justice, mercy, and equity in its work. And we want to share that award with all of you, because this is not work that we can do alone. It takes a community, and you are the community that helped make this happen. We're excited to share that we're growing. When we began to respond to this crisis in July, we had a staff of 65. As of today, we have a team of about 117, and we still have another 40 positions that we're bringing on board. We've been scaling up our teams to best suit the changing needs of the communities that we serve and the growing numbers of refugees, Afghan allies, and other forcibly displaced persons. We're hiring social workers, workforce development specialists, community engagement coordinators, and more. So we'll drop the link to employment opportunities in the chat, and please do pass that along to those that might be interested. We love referrals from you. There are also ongoing internship opportunities for social work students and others interested in refugee and immigration services. So check that out on our site too. And if any of you on this call are educators and would like to set up an internship program, please do let us know. We love to bring on new talent and young talent, and so we would be happy to start a program if we don't have one already. So Ernesta, I'm going to turn it back to you.
Thank you so much, Kristen, for that update and what you guys have been doing so far. And I have seen the amount of influx coming into especially the Fairfax office whenever I go. The team is always there ready to help everyone. So I appreciate all of the work that everyone is doing. And it's needless to say, you know, we need more people, we need more help. So if you're interested, please do apply to those positions that are available at LSSNCA. So thank you, Kristen. Next, we have Dr. Sai, Dr. Mamadou Sai. He is VP President of Operations. Dr. Sai has 15 years experience with LSSNCA with a focus on refugee and immigration services, to include our unaccompanied refugee minor program, a federal government contract providing loving, secure foster homes to youth, typically between the ages of 14 to 17. Since joining LSSNCA in 2004, he has helped resettle over 5,000 refugees in Virginia and Maryland. A graduate of Sheikh Anta Diop University in Dakar, Senegal, Dr. Sai holds a PhD in Egyptology. He is the author of several peer-reviewed articles. Dr. Sai is a former member of the Maryland Governor's Commission on African Affairs and currently serves as a member of the Virginia Department of Behavioral Health and Developmental Services Culture and Linguistic Competency Advisory Committee. And I can say between your credentials and Kristen's credentials, we definitely have the best people doing this work for us. So Dr. Sai, I'm going to hand the mic over to you.
Thank you, Highness. Thank you so much, and thank you for the introduction. Thank you all for attending today's town hall. As Christian shared, we have completed the first phase of what we would call the refugee resettlement journey. As many of you may remember, a few months ago when we saw the evacuation out of Kabul back in August, many of the Afghan allies, both SIVs that were not able to complete the processing, as well as the APA or the parolees, thousands of them were placed on military bases in the United States. There were 8 military bases throughout the US that have housed those Afghan allies and served as a safe haven for several months as the Department of State worked with resettlement agencies and with local communities to help resettle those individuals that are on those military bases. As of today, nearly over 76,000 Afghan allies have been processed, and many have been placed in throughout the country in many communities and have been welcomed and helped by many of those communities. Over the next few months, we will be shifting to a new reality, and that is how can we go from the first phase of resettlement, which is easing the transition from the country of origin to the first country of asylum, to shifting to what we would call the path to self-sufficiency. How can we make sure that those individuals that we have resettled will go from being assisted to being self-sufficient and active members of their communities? Over the next few months, in addition to the pipeline of Afghan allies, we will continue the resettlement. The resettlement will continue for several years, and we hope that it will, the U.S. admission numbers will continue to be high, because United States have always been an example and the leader in paving the way for U.S. For resettlement and refugee protection around the world. So we hope that to be able to continue. What we will see over the next few months will be also a shift to what we call the support services, and that is providing those clients that we have resettled with employment services, with support services that would help them take steps toward those the goal of being integrated in the United States, because the ultimate goal of U.S. resettlement program is to have people be part of the fabric of this nation for many, many more years to come. Our needs keep shifting along with the need of our clients. In Maryland, our donation temporary is imposed, but we have also changed offices. We have moved from Hyattsville to Greenbelt, but we will continue to ask for donations and volunteers to help us with not just the client that we have resettled, but the other client that we will be resettling over the next few months. In Virginia, the Virginia donations, visit our Amazon also wish list, which has been updated, and provide you with the new items that we need. We still need to help with furnishing the apartment. As you know, because of the large number of refugees that we have resettled, many were on temporary housing for several weeks, and now we need to shift them to permanent housing. And for that to happen, we will need assistance with furnishing those apartments. We also need some pro bono services. So whether it's helping with mental health professionals, or helping with optometrists, helping with folks that would help with mentoring refugees as we help them with their resumes, with the job search. We also will continue to need help with Uber, Lyft, gift card, and Metro card and bus cards, because as you know, many of our clients rely on public transportation to be able to get to their work or to get to the services that they need. Another way that you can get involved is through our Good Neighbor program. LSS have a very robust community engagement program. Through this Good Neighbor program, we are able to outreach to congregations and pull them into the resettlement program. And we have different levels. Level 1, which is a much longer commitment of 1 year for congregations to help with the resettlement of refugees. And it involves securing housing, helping with adjustment support, and helping with rental assistance. And the level 2, it's a 6-month commitment where congregations and groups can also be assisting families with both welcoming them as well as with adjustment support. And then we have the level 3, which is a much shorter commitment from congregations, but they also have a multiple donation drives that can help our refugees. We created these 3 different levels because we wanted to make sure that we're meeting congregation where they are. So regardless of their size and the resources, every single congregation, every single individual out there could be involved in the resettlement of the refugees in the United States. Thank you. Get back to Kristen.
Thank you so much, Mamadou Sai, for that update. Really appreciate it. Now we're going to switch back to Kristen, and she's going to give us some information on community engagement.
Wonderful. Thank you so much, Harnessa and Mamadou. Well, we just so appreciate you showing up and accompanying our new neighbors on their path to self-sufficiency and well-being. I know Mamadou was sharing a bit about the Good Neighbor Partner Program, and I just wanted to highlight, we've worked then with more than 100 Good Neighbor Partner programs across Virginia and Maryland, and we need to add more to our ranks. Many times our calls will come with only 72 hours notice to set up a new apartment. So stand by your email, and please do continue to reach out if you'd like to be a partner in that program. A great way to ensure that our new neighbors are set up for self-sufficiency is to assist us also in identifying permanent housing. Housing is one of our greatest challenges to moving our new neighbors along the path to independence. Given the incredible volume of people we are serving and the already pre-existing affordable housing crisis, or the shortage in affordable housing, it's taking a while for us to move people from temporary housing to long-term permanent housing. And permanent housing is so critical for the healing and the resilience of the families we're serving, who've experienced so much trauma in such a short amount of time. And we really want to be able to provide them that permanent home. And that permanent home will help our adults, feel more secure about finding full-time employment because they know where they'll be living, and ensure that kids are school enrollment won't be disrupted. So if you do have housing leads, please do let us know. We'd love to hear them. We are also continuously updating our Amazon wish list with our greatest needs items, and thank you again for contributing to those. We have received such an abundance from all of you from this wish list, and it's allowed us to provide our new neighbors with the items they need to outfit their new homes here. As you know, many are arriving with nothing but what they have on their backs. And so what you're able to provide us through these wish lists really help our families settle into their new homes. And then another way you can help is by telling your state representatives to introduce and support the Afghan Adjustment Act. This act creates a clear legal pathway to legal permanent status for Afghans who arrived with parole status. It allows that pathway after they've been here for 1 year. And without that, they will need to go back to the back of the line and apply for either special immigrant visa status or another type of immigration relief. And there are already more than 1 million cases backlogged. We also know that there is a shortage of pro bono attorneys to provide this work. Wait lists that we've seen for other programs that we serve are more than 6 months. So this puts our new neighbors in jeopardy for permanent employment, school enrollment, and housing. And so we'll drop a link about how to advocate for this act in the chat. I do want to note before we open it up for Q&A that LSSNCA serves forcibly displaced persons from throughout the world. And so we are so grateful for your support of our work with Afghan Allies. And we will continue to serve those who are arriving from all over the world in days to come. We currently have a program that serves asylum seekers. And then our refugee program is starting to serve clients from other pipelines. So people from Burma, and so we are so grateful that you've joined the LSSNCA table, and we look forward to working with you to welcome many more people to the DC metro area in the days and years to come. So thank you again, and I'll turn it back to you, Haranessa, for opening it up for Q&A.
Thank you so much, Kristen. And Mamadou, you can come back on as well, and we'll start our Q&A. And I want to thank everyone for being here tonight. Again, if you have questions, please drop it in the chat, and we'll do our best to get to all of the questions. And I will start with one that just came in because we were talking about housing. How do you define permanent housing, and what is the length of time that is needed for that to be considered permanent housing?
Well, up until when we faced the surge, temporary housing was 2 weeks. And then from then on, it is permanent housing. So it is getting the folks to an apartment that is fully furnished, that meet all the criteria set by the State Department, and for much longer than 6 months, 7 months. So the window for what we call temporary in the resettlement has changed over the past several months. It has gone from the traditional 2 weeks to now maybe a month or a couple of months before we're able to secure permanent housing. So permanent housing is from when we get them a house, a lease that could be of at least of 1 year.
Okay, great. At least 1 year, and more than 7 months, 6, 7 months. Okay, that makes sense. Another question is, while there is a pause in Maryland, can we register now for GNP? And either one of you can take that question.
Yes, absolutely. We are always in need of GNPs, and we're always working to onboard new GNPs. The process, the pause in Maryland is just for a very short window. We will resume accepting new cases very soon. And so during that window, we can have the onboarding, the orientation, and make sure that all the paperwork is in place so that whenever we resume with accepting cases in Maryland, the GNP is already ready.
For those of you who don't know, GNP stands for Good Neighbors Program. Yeah, that we have here at LSSNCA. We've become very accustomed to using acronyms everywhere we go. So we're trying to make it easier for everyone. But of course, we need to know what those things stand for. So thank you, Mamadou and Kristen. You mentioned that this is the largest resettlement LSS has ever done. Where's the financial support coming from?
Well, the financial support comes from both the federal government, the state, but also the communities, because along with the additional funding that we have received from the State Department to be able to serve those clients, and from the Office of Refugee Resettlement to help with what we would call the domestic needs, we also have received, seen some generous donations, and those have helped a lot support LSSNCA. Many of you may remember that when we began resettling the Afghan Allies, especially the Afghan parolees, they were not eligible for any program. So they could not access the ORR benefit, the Office of Refugee Resettlement benefit. And for that reason, what it also meant is that the staff that were funded through those programs cannot even work with those clients. So we had to rely on generous donations from the community to be able to create parallel structures to help support those Afghan parolees while we wait for our federal government to change the requirement and start expanding the benefit of ORR grants to the APA. And that happened in October. So that means from August, when we started resettling the APA, the Afghan parolees, through early October, LSS had to rely on the generous donation from the community. Then on, we have received some funding from the State Department and ORR to continue to serve them. What we will see over the next few months will be that the funding from the State Department will go down or even dry up, while we see maybe a shift to the ORR, which will fund the employment services program and the vocational trainings that clients need to be self-sufficient.
Thank you so much, Mamadou. I know that people can go on the website and look at this, but briefly, Mamadou, can you just touch on what the GNP tier 1 and tier 2 cover for the fees? What does it actually give to the refugees when people sign up for the GNP?
Yeah, so for the GNP one is a longer commitment. So it's a commitment of 1 year from the GNP group to help secure, work with LSSNCA case management team to help secure an apartment and provide housing assistance for an individual for up to a year. During that year, LSSNCA will continue to provide support to the GNP and make sure that we are in close contact and communication with the GNP and continue to provide services to the family. The level 2, it's a much shorter commitment. Sometime it could be just an apartment setup where the contact with the clients may not occur. At least traditionally, because the apartment setup were occurring before a refugee arrives, there was limited interaction between the level 2 and the refugee family. Whereas in the level 1, it's a much longer commitment and a lot more involvement, a lot more services required. So as I mentioned earlier, the different levels were just designed so that every single congregation, every single group that want to be part of resettlement will find a way to get involved.
That's great. Thank you so much for breaking that down. Kristen, this one's for you. You did mention that there are about 1 million cases still pending. Are you referring in terms of people applying for asylum?
Yes, sorry. Was this referring to of the backlog for asylum cases? Okay, yes.
So there's 1 million cases pending with USCIS?
Yes, and so I think, you know, I think what's important to note here is the humanitarian parole was set up as a mechanism to get you know, Afghans safely out of Afghanistan. And the typical mechanism of using the special immigrant visa status, because you know, due to the chaotic nature of the evacuation, the impetus was just to get people out quickly and safely. And so although, you know, although the humanitarian parole mechanism was effective in getting people out safely, the challenges that it brings is that unlike a refugee or someone with special immigrant visa status who arrives with a status, who arrives with documentation, who arrives eligible for benefits, and you know, the persons with parole status were not able to access benefits until October 1st. So when Mamadou was talking earlier about the funding gap that we had, there was a period of time where we were serving people who were not yet eligible for things like medical assistance or cash assistance. They also, those with parole status, there's a longer delay with documentation, and documentation is so important for things like employment and for finding housing. And then the other challenge, as I mentioned, that comes with the parole status is not having a legal pathway to permanent citizenship. And so that's what the Afghan Adjustment Act will do, will allow those with parole status for that status adjustment, rather than contributing to the backlog of cases and requiring the application for other types of relief.
Okay, great. Thank you so much for that. I want to tap into paying for rent and utilities. Who usually takes care of that once they get into their permanent housing?
Well, that would vary. It's really on a case by case and depending on what program they are enrolled in. So if someone moves from a temporary housing to a permanent housing, the funding, there are several funding streams that they can tap into. It could be either what we call the reception and placement, or the per capita, which is funded through the State Department. And if they are all a matching grant, they could get some funding from matching grant. There are some additional fundings that we also have that would, whether it's RTCA, the Refugee Temporary Cash Assistance, or the TENF. So it's really, there are so many programs that could pay for it. So it would depend on the size of the family, the makeup of the family, whether they have children or not, and then the program they are enrolled in. So it would be hard to just indicate all the sources without exactly knowing what program the clients will be enrolled in or what services they will be eligible under that umbrella of program.
So does LSS actually help the clients apply for all of these benefits?
Yes, for every single client that we resettle, they are automatically assigned a case manager. So the case manager is really the client at the center. The case manager is the one to help them access the benefits, either directly or working with the US ties or with volunteers to help them access the benefits. So, but the case manager is really the primary person that the refugee individual or the refugee case work with for the duration of the reception and placement. And once that process is complete, depending on which program they are hopping on, that program will take over. And it's either an extended case manager or a job developer will that take from there on to continue providing the services.
Okay, great. I'm going to shift a little and talk about mechanisms which are used for coordinating among various support organizations for the refugees, and specifically what is done to prevent competitive fundraising appeals. I think this is just for us to realize that what LSS is doing is trying to make sure that we're giving the best amount of care that we can for our clients, Kristen. And I know in the DMV, it's very competitive in all sorts of areas to try to get the funding. So what is it that we're doing to appeal to those donors?
Sure, I think I can start, and I may share this response with Mamadou. I think the beauty of this response to Afghan Allies is that it has brought so many different people to the LSSNCA table that weren't at our table before. In the last 6 months, we've increased. You heard how many volunteers we have now. We have more than 2,000. In previous years, we had 250 to 350. We've increased our donor base. We have groups from the Afghan community. We have groups from the veteran community who have really leaned in to support our efforts to welcome Afghan allies. They're working alongside our caseworkers to help relieve some of the stress and helping to do things like enroll kids in school. So one of the things that we've been talking about with our federal and national partners is having ways to have some funding for our GNP program. And so that would allow some of our GNP partners to be supported in the work that they're doing. So those are conversations that are happening. And I think there's a lot of work to go around. Another temporary solution that was put in place to really help Lutheran Immigration and Refugee Service on LSSNCA's behalf opened a temporary site in Alexandria. This site was to really help us with being able to welcome this historic number of Afghan allies. We've served, as I mentioned, 4,000 people since July, and in our record year, we served about 1,600. And so with the support of this LARS temporary office, we were able to add another 1,000 cases. And those cases, the LARS office will be closing when this surge of cases slows down, and then those cases will be transferred to us. And so, I guess to answer that question, we are certainly coordinating with other organizations doing this work. We value multiple voices and multiple groups at the table. We think that this work takes a community. We're finding ways to ensure that other organizations that add value are able to, and who are interested and want to help, are being invited to do so. We are really grateful for the collaborative relationships we've built. But Mamadou, is there anything else you wanted to add to that?
Yeah, I think you covered it all. What the wave of Afghan allies has done over the past several months is really trigger what I call the surge of compassion. So we have seen a lot of folks come forward that want to get involved, and some have donated to LSSNCA, and LSSNCA has always understood that the backbone of the U.S. resettlement is community engagement. So, and that's what prompted us a few years ago well before this crisis to create the Good Neighbor program, because we wanted to really rely on those congregations and group of volunteers to help build that support that we know is needed for the long-term refugee integration. We know that even though refugees are resettled through the resettlement agencies, they are not refugees of the resettlement agencies. They are refugees of the communities that they join. So we have already we are known to be a great organization that helped refugees and that have attracted a lot of people to come forward and support LSSNCA. So whether it's through donations or through volunteers or through the GNP program.
Thank you guys so much. And with that, there's questions about volunteering and how people can volunteer. I'm going to let one of you, give a little blurb about our website and how they can go to our website and sign up as a volunteer. And I'll get to the next question.
Happy to do that.
Go ahead. Go ahead.
We can share it. Please fill in what I missed. Please do go to our website. I'll have our team drop that into the Q&A. So if you look at the Q&A at the bottom of your screen, that's where we're responding to questions live. So there is a site, there is a place to sign up as a volunteer. We need volunteers for things like transportation, for interview practice with people who are looking for jobs. I think volunteering could, and also helping us identify and vet housing leads would be a big area that we need some volunteer support. And Mamadou, what other areas do you want to highlight?
So really, I mean, the job search would be one of the need of the next few months, because now that we are the tail end of this crisis, we need to shift to finding employment and helping people with their resumes, helping them with mock interviews, helping them with job search. And we need a lot of volunteers. So our employment team is increasing along with our case management team so that we can have a lot more support to help secure employment for these folks and get them on the path to self-sufficiency.
Great. And I'm going to tie that in with the question about internship coming in. Are the internships paid or are they volunteer based?
Our internships are not paid. At least now they are not. But we do have some great and very exciting internship opportunities for students. So we always would love to have them. So if anyone is interested, to reach out to us and we'll find a way to get them matched with some very exciting responsibilities within the agency.
Awesome. Thank you. So my next question, and I guess it resonates a little bit more closer with me as someone who is from Afghanistan. I came here as a child refugee way back when the Soviets had invaded, and seeing the process going now with newly arrived Afghans and trying to acclimate with everything that's going on here and making sure that they're providing the best care for their family and not really knowing the system at all. Some of them struggling with family, with translation, understanding the cultural competency of how it is in the United States and what it means to be able to move around. There's a lot of talk of people really flooding the gates, like you mentioned, Kristen, of applying for asylum if there's 1 million people on that wait list. And then we have this Afghan Adjustable Act, which I personally spoke to Senator Kaine about, to promote that act and make sure that that's another way for Afghans to get the okay to apply for a green card so that they can get residency here in the United States. Because talking to so many attorneys, the likelihood of Afghans applying for asylum, the chances are very minimal for most of them, right? So I would see that this would probably be a best bet for our Congress to pass. So you mentioned that we should reach out to our elected officials. And when we reach out to them, what should we say? How should we pitch this to them in terms of just what you've seen on the ground with the Afghans coming in through your office? And either one of you can answer that, or both of you.
Sure, maybe I'll go first. I think what the process we have now is that, as Kristen mentioned, those that were not eligible for the SIV, or those that were pursuing the SIV status and then was interrupted and then shifted to parolees and admitted in the United States, have a window of 1 year to submit for an adjustment of status? Well, if we have to do that individually, so if you have a family of 5 or 6 people and every one of them has to complete it, we know how daunting that task could be. Through the AAA, the Afghan Adjustment Act, what we hope to see is that all of the group will be afforded that the benefit of being able to adjust without having to individually complete those applications. Or even if they have to, so that there is a much faster track for them to get the approved, rather than being put behind a very huge backlog of asylum cases, which you know would not only be a hindrance to early self-sufficiency, but also would even prevent some of them from being active members of this community. So I think the most viable option and the most viable path would be through the AAA. But in the meantime, what we're doing at LSS is look at helping those clients who have reached out and want to start the process, because I think 6 months into their APA status, they can start the process. And the hope is that even if they were to start the process now, that once the act is passed, that they would automatically be grandfathered into it.
Just going to add a few thoughts to that. And I think, one is, this is an equity issue. We have people we are serving that have, very similar lived experiences and fact patterns that have 2 different situations with their legal cases. And so part of this is an equity issue where, the Afghan Adjustment Act would give a pathway to legal status for persons that we've already recognized should have that pathway to legal service through the SIV program. So I think that's one way that you could respond to when you're speaking to Congress. We are legislators. I think another piece, and it's just building on what Mamadou said, I think it is critical. Legal permanency is really critical to independence and self-sufficiency. And right now, those with the parole status don't have that because there's hesitancy amongst employers to hire people with the status when they don't know if that status will be permanent. It makes it a lot harder to make decisions about your future when you're not clear about your status in the country. So I think it would help with things like self-sufficiency and financial independence. I also think in terms of mental health, there's a lot of anxiety when you don't know what your future is going to look like. And so I think for people to be able to start the healing process and moving on, they need some permanency, and to be able to know that the evacuation, that they were brought here and that they're going to be cared for and protected. And I think we owe that to the Afghans. I think they deserve that. And I think it's really an equity and justice issue too.
Yeah, and I loved how you brought in the compassion and empathy part of this, because as human beings, we tend to just run the mill and just trying to get paperwork done and put things to the side, and we forget, like you said, the mental health aspect of this and the trauma that people go through coming to another country, especially when cultures are so different, languages are so different, and you're trying to make it and everything's so uncertain. So I'm really grateful that you mentioned that. Mamadou, to the point what you made about applying for asylum, and if that act, the AAA Act, goes through in Congress and gets approved, is that something that LSNCA helps each client fill out, or is that referred to somewhere else?
Well, for the adjustment, clients would need to complete the I-589, if my recollection is correct, and that requires someone who is either an immigration lawyer or someone who is a Board of Immigration Appeal accredited to complete the form. So, as you know, agencies do not have a lot of staff that have those credentials. So it really would. It's a very steep climb to be able to help. What we could do is have our BI accredited staff work with volunteers and then have the volunteers maybe complete those forms. But what we also could do down the road is maybe have a legal clinic at one of our offices and invite immigration lawyers, because we have seen also a surge of immigration lawyers that want to help, and see whether we can have pro bono lawyers helping with completing those applications.
Yeah, that would be great. That would be a great added benefit. Okay, next question is, are you aware or prepared for the next wave of settlements of people waiting in Doha and other countries? Do we have information on that?
Yes, as you know, and that's a very good point, because when we evacuated, when evacuations occurred back in August, not everyone were placed in the United States in military bases. So we had some that stayed overseas on what the State Department called Billy Pads, and those will be resettled in the United States. The hope and the plan is that they will be resettled with the refugee status. What that will do is that it would help circumvent all the obstacles that we are experiencing now with the parolees. The downside of it is that path tend to be a very lengthy path. The commitment from the White House and the State Department is that they could narrow that window to maybe 30 days to have someone complete the entire process and be resettled in the United States. Well, if that's the case, then we definitely have learned a lot from the search, and I think we have in place the coalitions and the structures we need to be able to resettle them in a much better and more organized way than what we had to deal with during the summer.
That's good to know. Good information coming in. So let's talk about backlog, especially with funding, and how that affects LSSNCA when it's coming from the government, and then the influx of people that's coming, but the funding is not coming in time. How are we working around that, and what does that mean?
So thanks for that question. The Refugee Resettlement Program has always been a public-private partnership, and it would not exist if we relied on the public funds alone. Some of the challenges with the way the program is administered, and I'm going to reflect back to the previous administration, is when there is a different philosophy in the administration on refugee admissions, like there was in the last administration, which resulted in a downscaling of the program. It takes time to build that up. And so what happened in this past year was the resettlement program, the U.S. resettlement program as a whole, had been dismantled essentially. And it's at the point when we were beginning to look towards the rebuilding that we were responding to the humanitarian crisis of Afghanistan. And so part of the challenge is we went from, as LSS, for example, we went from an organization that was serving 1,600 refugees a year, and then the previous administration, 500 refugees a year. And then it went overnight to 500 people a month. And the funds to develop that infrastructure, they didn't happen until we began the work. And so we've essentially doubled our staff in the past 6 months, but that takes time, and building the infrastructure takes time. And so that's where it is really helpful to have the support from our community partners. When we have additional funds from the community, it allows us to do things that aren't covered by government funds. And both on the client service side and on the operational infrastructure side. So I'll give an example for both. So when the US began evacuating Afghans using humanitarian parole, at that time, people with humanitarian parole were not eligible for the same benefits as a refugee or as an SIV holder. And so that also meant that we weren't able to use our funding from the Office of Refugee Resettlement to serve them because they weren't eligible. So through unrestricted funding, we were able to hire positions to begin serving the persons who had parole status until they became eligible for parole status on October 1st. And then that government funding took over for those positions. Likewise, during that time, we were able to use unrestricted dollars to pay for things like medical services, which weren't being covered at the time. I would say now that there's that those with parole status are eligible for the same benefits, some of the funding gaps, our biggest funding gap is around housing. I don't think we can underscore enough the lack of affordable housing in the DMV. I think we all know that the price of housing here and the funds we get from the government don't really cover the costs. And when we think about the time it takes to get persons enrolled in benefits and get their documents and find employment, they don't have enough. Often that's as the time that's happening is when the funds to support housing from the government are drying out. So with the unrestricted dollars, we're able, and from community grants and from state grants and from all these other funds that we're able to pull together, that's how we're able to help pay for some of these additional basic needs and costs like housing to really help set up our families for independence and to give them that time they need to find employment and to get their documents in order. So, Mohammed, is there anything that you wanted to add to that I missed?
Sure. I just wanted to add that, and my hope and prayer is that the surge of compassion that we have seen with the Afghan Allies continues beyond this first surge, because we know that we will be resettling other groups, other refugees from all over the world, and they have also some need. So my hope is that we will continue to see the support from the communities well beyond the resettlement of the Afghans and well beyond this first surge. We know that the U.S. resettlement program tend to be front-loaded. A lot of funding maybe early on, and that funding fades away when the refugees need it the most. So we definitely, and as Christy mentioned, it is a public-private partnership. I think federal government has done a very good job of supporting the program, but we also need some support from the community to continue over the next few months and years to help these groups be part of the fabric of this nation, not just for a few months, but for years and generations to come.
Great. Thank you guys for that explanation. And for those of you listening in who are asking about getting a copy of the recording, yes, we will send it to you, and so that you can have access to all the information here tonight and the slides as well. So look out for that in your email either tonight or tomorrow. That will be coming out to you in the next few hours. Let's shift to Maryland a little bit, because there are questions about Baltimore and the Maryland office and what's happening there. Do we have an office in Baltimore? Are we going to get one? How are we allocating resources in Maryland?
Sorry, can you repeat the question, please?
Sure. So they're asking about Maryland, and specifically if we have an office in Baltimore. If not, is that part of something within our future to get an office in Baltimore? And overall, the Hyattsville office moved to Greenbelt. What does that mean for the resettlement of the refugees in Maryland?
Sure, absolutely. Maryland has, for LSSNCA, for the fiscal year 2022, we are projected to resettle 1,000 refugees through our 3 sites. Up until fiscal year 2021, we had 1 site in Hyattsville. We have outgrown that space. We have more than doubled our staff in Hyattsville, and we were not able to stay within the same location. So that's the move to Greenbelt. But we will continue to serve refugees and throughout that area. What we also did as to get ready for the surge is not just to increase the capacity of our existing site, but we also opened 2 new sites. So we opened a site in Arbutus in Baltimore County, and we opened a new site in Frederick. So we do not have a site in Baltimore City, but we do have in Arbutus in Baltimore County, where we projected to resettle 350 for the fiscal year 2022. So refugee resettlement in Maryland is as strong as in Virginia. In fact, in recent weeks, what we have seen is completely a shift where the busiest office is our Greenbelt or Hyattsville office, and not maybe our Del City and Fairfax. So that shift is prompted by the fact that refugees who were not able to get services in Virginia, or may have some family members in Maryland, have elected to be resettled in Maryland, or some other refugees that may be planned to be resettled in other part of the country has chosen to be in Maryland instead of some other part of the country. So we are seeing a surge of Afghan allies being currently placed in Maryland, and that we also expect that to continue. In Frederick, we already have 3 or 4 groups, GNP partners, that have resettled over 6 cases there, and we also hope to continue to provide services to that area. Baltimore City, LSSNCA had an office in Baltimore City until a few years ago when we decided to close that office because of the reduction in the U.S. refugee admission numbers. So we do not currently have planned to go back to Baltimore City, but we think what we can operate from Baltimore County could definitely be extended and expanded to Baltimore City.
Great. Thank you so much, Mahmoud. That was very informative. I'm learning so much myself because there's so many things that are shifting within LSSNCA that you guys are up on top of the information and been able to give a lot of great information to all of us. So let's go back to permanent housing because, Kristen, as you said, that's such a big need right now. And it's the most problematic one because there's not enough affordable housing and it's so expensive to live here that $1,225 that would go way further if it was another area than it would be here in the DMV. You know, what's going to happen to these families who are extremely large and can't find affordable housing? What are we doing with them right now? Is there a plan? Are we just keeping them in hotels or in their permanent homes? What are we envisioning to do with that?
Well, at LSS, we have housing coordinators in both Maryland and Virginia who are working diligently to get them off of the temporary housing. Our goal is to get every single one of them off of the temporary housing onto permanent housing. What may change is just the length before that is doable. We have added some logistic coordinators that are helping us with the outreach to new housing providers. And with that housing outreach, our intent to be able to secure more housing. But I also think that everyone on this call can be an ambassador and an outreach coordinator for LSSNCA. So if you know of any housing opportunities out there, if you have any connection with housing providers, please feel free to reach out to us and we will reach out to those folks and work with them and help clients move to permanent housing. We know that permanent housing is really the first block of the launching pad to self-sufficiency. So we really want to make sure that we put a lot of time to securing housing. In Virginia and Maryland, the situation is not just a matter of availability, but also affordability, but also its availability. So because just keep in mind that what we have seen combined between Virginia and Maryland in the past several months is the numbers that it would have taken 5 or 6 years to resettle. So we have the numbers, and the pace of resettlement is just way above what the current housing vacancy rate is in the area. So we want every one of you to be an advocate for us, to help us reach out to any connection that you have.
Great. And with all the limitations that people have in order to get a job and get into their homes, what does LSSNCA need from the community in order to help the people who are having trouble getting a job, who are having trouble finding a place to live? What does LSSNCA need right now from the community to help them?
Well, definitely. I mean, and I should stress this first. The community support has been absolutely great, and we are very grateful of that support. LSS would not have been able to resettle the numbers that we have resettled within a very short window without the support of those communities. We want every single one of us to be a job developer, every one of us to be a housing coordinator. So if you see any opportunities for employment, if you know of any employer who's hiring, if you are hiring, if you are an employer, if you're hiring, please feel free to reach out to LSSNCA. We have put in place very robust employment team. Our workforce development team will be able to work with you and to help secure place those clients. So, but we definitely want every one of us to be an ambassador to the refugees that we resettle, to be an advocate for them, to help, also to be a pathfinder. If you see a housing, if you see an employment, if you see a help wanted sign somewhere, just think of LSSNCA, shoot us an email, call us, and we will be able to follow up on those leads.
And I'm sure if you have extra money in your account that you would love to donate, we would greatly appreciate that also at LSSNCA, because that in itself would turn into support for the families because they can't get a job. And LSSNCA does not abandon anyone. They try to help everyone. But of course, without funding, we can't do that. So if you would like to donate to LSSNCA, you can visit our website and do that as well, because funding does go a long way. And I've seen it with my own eyes in terms of how it's been helping families in that situation. Mamadou, you mentioned that there are 350 who are being settled in Arbutus, Maryland. Is that individuals or families?
Individuals. So that's our projected for the entire fiscal year will be 350 for our Arbutus office. Yeah, and those will be individuals.
Okay, great. Thank you for that. Next question is just normally how long does it take for the refugees to become self-sufficient? And you mean you went over everything right now, both of you, in terms of how it's taking so much long for them to be self-sufficient. But let's say if this was a normal situation, how long would that have normally taken?
Well, it usually varies, but it's an average. It may take up to 6 months to a year for someone to be able to stand on their own, and that's why for the GNP level 1 we set the length of commitment to 1 year. So that 1 year is really a key in terms of helping someone start taking major steps toward long-term refugee integration.
Okay, thank you. My next question that somebody is asking, the only reason I'm asking this question is because this is something that a lot of people ask, and I'm putting this on the table so that people know where and what LSSNCA does and what things they're not in the realm of where they can't help. And this is strictly tied into the SIV's family members who are stuck back in Afghanistan and they want to bring them. And people are asking, well, if LSSNCA is doing all this resettlement, what can they do to bring the families from Afghanistan here? And I want to answer this question because I would like for people to know what LSS actually can do and what it can't do in this realm.
So we've actually been recommending that people go to Congressman Connolly's office. Congressman Connolly has been his office has been such a supporter of continuing to advocate for family members to be evacuated from Afghanistan. They have submitted the largest number of requests to the State Department of any congressional office, and they will do so even if you are not in their district. And so if one of my colleagues can put that information in the chat, that would be great.
Thank you so much, Kristen. And it's interesting how people are always worried about their family back home. I have cousins and uncles and aunts stuck in Kabul and Mazar Sharif who were texting me left and right in August and September. And I went through the same process you just mentioned and going through an elected official who was working on this in a very diligent way. And of course, this is to highlight that LSSNCA can take care of so many things with the refugees who are coming here in the United States. Unfortunately, we don't have the bandwidth or even the access to help bring anyone from overseas. If their paperwork goes through, they will probably come through LSSNCA to settle here. But that process is completely up to the government in terms of how they're actually going to process people coming into this. You mentioned volunteers helping with research and coming in and helping with forms and resume writing and interviews. People are asking how can they get involved more in that except going through the website? If they go through the website and they apply, how long will it take for someone to reply to them and for them to actually get in there and actually help out as much as they can?
Well, we know that we have a backlog of volunteers, but I would encourage people to continue to reach out and through the website. We are moving very fast now to vetting those volunteers and helping them. If you have submitted and for a while you have not heard for anything, please reach out to us, call us, email us, let us know so that we can definitely make sure that somebody circles back to you. What the current need on the employment side, on the workforce development side, is great. So I'm sure that even if you had applied for case management, if you think that you want to maybe shift and do something with the job, with the employment search, let us know. Just shoot us an email. I would say if you submit your application and wait for a while and did not hear from anyone, please reach out, email us, and we'll make sure that we'll get to your application. Christian?
I just wanted to echo, I'm just going to do a blanket apology. When we first started responding to this crisis, we were overwhelmed in this wonderful way by the outpouring of support from all of you. And we received more than 5,000 interest forms from volunteers. And we've been able to vet and deploy and about 2,000. So that's so we're making our way through. But as Mamadou said, if you're on that list of 5,000 and you haven't heard from us yet, it's not because we're not interested. It's not because we don't need you. It's because when that happened, we had a setup for about 250 volunteers a year, and we're just still building up that program. We do have fantastic colleagues who are putting their information in the chat, who you can email directly to inquire about the status. I think what is important here is, we've been talking a lot as a team about how this response has looked a lot more like a disaster response than resettlement as usual. And it's looked like a disaster response in that because of what happened and the trauma being so fresh and the need for us to respond to the volume at the level it was, and also because I think the interest was, we had a lot of public interest at the beginning, and now we're starting to see that wane a bit. And so those of you who are on this call because you are committed to our mission, whether it's in the headlines or not. And it's you who we're going to need to be by our side to continue to welcome people who are forcibly displaced in the months and years to come. And that those populations may change, but their histories and what they've experienced and their needs are still going to require a community to provide that support. So I apologize for our delay in response, and we'll let you know that as we are building and growing our infrastructure, that response will get better, and that we do need you and we do want you to keep reaching out to us and asking how you can help and letting us know the areas you want to lean in.
Thank you so much, Kristen. And I love the fact that we can be real and talk about exactly where we're standing with things, and that life is not perfect, but we're trying our best to move things along as fast as we can. And with that, I want to thank you all so much for all of your lovely questions. I hope this was informative and that we keep the connections going. And if you have any questions, please visit our website, email us, and we'll get back to you as soon as we can with the answers if we haven't been able to answer tonight. I want to thank Kristen Peck, Mamadou Sai for joining me and having this discussion, but it would not be possible without everyone in the backstage. I had their names up here right now and then it disappeared. But Etienne, Fatimata, Jennifer, so many other people that are part of the LSSNCA team that are backstage right now doing the Zoom and keeping everything going. Kyle and everybody else who's just doing an amazing work to make this happen. Autumn, Abdul, and honestly, we couldn't have done this without them, because without teamwork, nothing gets done. It's not just one person. And like Kristen and Mamadou mentioned, that we need the whole community, we need the government, we need LSS, all of us to work together to be cohesive and to be able to move this thing forward, so that we can become a better figment in a placement of organization in this community, so that we can help all the refugees coming in from all over the world, regardless of where they're from. Please visit our website and get familiar with it. All the programs that we mentioned tonight are on our website. You can follow us on Twitter. We do have a handle. It's LSS_NCA. We do update that quite often. And on behalf of everyone at LSSNCA, I want to thank you so much for coming on and listening and being part of this discussion, and really asking really great questions, so that sometimes you ask questions that we don't think about, and that's something we have to go back and think about and say how we're going to fix that. So we want to thank all of you for joining us tonight. We'll hope to see you next time. Have a great night and see you later. Bye-bye.